Hello everyone and welcome. Today we're diving into a common, yet often overlooked, digestive health issue: dry mouth, also known as xerostomia. While it might seem like just a minor inconvenience, chronic dry mouth can significantly impact your oral health, digestion, and overall well-being. Let's explore what causes it, how it affects your body, and what you can do about it. So, what exactly causes dry mouth? The list is actually quite extensive. The most common culprit is medication. Many prescription and over-the-counter drugs like antihistamines, decongestants, pain relievers, diuretics, and antidepressants can have dry mouth as a side effect. Certain medical conditions also contribute, including Sjogren's syndrome, diabetes, Alzheimer's disease, and rheumatoid arthritis. Radiation therapy to the head and neck, often used to treat cancer, can damage salivary glands. Dehydration, whether due to insufficient fluid intake or excessive sweating, plays a role. And sometimes, simply aging leads to reduced salivary gland function. Lifestyle factors like smoking or chewing tobacco can also exacerbate the problem. To understand dry mouth, it's important to know how saliva works. Saliva is essential for oral health and digestion. It helps neutralize acids, washes away food particles, and provides enzymes that begin breaking down food. When salivary glands don't produce enough saliva, this delicate balance is disrupted. The mouth becomes more acidic, increasing the risk of tooth decay and gum disease. Difficulty swallowing and speaking can occur, impacting nutrient absorption and leading to discomfort. Without adequate saliva, the mouth's natural cleansing action is impaired, creating a breeding ground for bacteria and fungi. Dry mouth is surprisingly prevalent. While precise numbers are difficult to pin down, it's estimated that around 22% of the general population experiences dry mouth. The incidence increases with age, with older adults being particularly susceptible due to a higher likelihood of taking multiple medications and having underlying medical conditions. Women are also more prone to dry mouth than men, especially after menopause due to hormonal changes. Additionally, individuals undergoing cancer treatment, particularly radiation therapy to the head and neck, have a significantly elevated risk. The symptoms of dry mouth extend beyond just feeling thirsty. You might experience a sticky, dry feeling in the mouth, a sore throat, hoarseness, or difficulty speaking or swallowing. You might also notice a changed sense of taste, a burning sensation in the mouth, and problems wearing dentures. Dry mouth also makes your teeth more susceptible to decay, so you may experience more cavities. Cracking at the corners of the mouth and a dry, red tongue are other common signs. Keep in mind that the severity of symptoms can vary from person to person. Diagnosing dry mouth typically involves a thorough medical history and physical examination by your dentist or doctor. They'll ask about your medications, medical conditions, and any recent treatments you've undergone. They'll also examine your mouth, looking for signs of dryness, inflammation, and infection. Salivary flow rate tests can measure the amount of saliva your glands are producing. In some cases, a salivary gland biopsy might be necessary to rule out underlying conditions like Sjogren's syndrome. Silometry, a test measuring salivary gland function, can also provide valuable information. While there aren't specific classifications of dry mouth types, the condition can be categorized by its underlying cause. We can classify it by whether it's medication-induced, related to a systemic disease like Sjogren's, a consequence of radiation therapy, or due to other factors like dehydration or lifestyle choices. Understanding the cause is crucial for effective treatment. Managing dry mouth focuses on relieving symptoms and addressing the underlying cause. If medication is the culprit, your doctor may be able to adjust the dosage or switch you to a different drug. Artificial saliva products, like sprays, lozenges, and gels, can help lubricate the mouth. Frequent sips of water throughout the day are crucial. Sugar-free gum or candies can stimulate saliva production. Your dentist might prescribe fluoride treatments to prevent tooth decay. In severe cases, medications like pilocarpine or cevimeline, which stimulate salivary gland function, might be prescribed. Good oral hygiene is paramount. Brushing twice daily with fluoride toothpaste, flossing daily, and regular dental checkups are essential. Preventing dry mouth involves several key strategies. Stay hydrated by drinking plenty of water throughout the day. Avoid sugary drinks, which can contribute to tooth decay. Limit caffeine and alcohol, as these can dehydrate you. If you smoke or chew tobacco, consider quitting. Use a humidifier, especially at night, to add moisture to the air. Avoid salty, spicy, or acidic foods, which can irritate a dry mouth. Practice good oral hygiene by brushing, flossing, and visiting your dentist regularly. The prognosis for dry mouth depends largely on the underlying cause and the effectiveness of treatment. While dry mouth is often a chronic condition, many people can manage their symptoms effectively with lifestyle changes and appropriate treatments. Recent research is focusing on developing more effective artificial saliva products and therapies that stimulate salivary gland regeneration. Gene therapy and stem cell research hold promise for future treatments. Furthermore, advancements in understanding the mechanisms of salivary gland dysfunction are paving the way for more targeted and personalized approaches to managing dry mouth. By working closely with your healthcare providers and adopting proactive strategies, you can significantly improve your quality of life and minimize the impact of dry mouth.